Thank you for tuning in to Recovering Your Health with Nutrition. Here we talk all things health and wellness. My name is Ife and I'm a licensed family nurse practitioner. And today I want to share with you some tips that will hopefully help you and your family navigate during this pandemic. I want to share some ideas and tips that will help to keep you healthy. Tip number one is very common. I'm sure you've heard of it, but I want to remind you, please make sure you have your honey, lemon, and ginger tea on hand. Honey is very beneficial in terms of fighting infection, strengthening your immune system. It has wonderful antimicrobial properties, antifungal, antiviral as well. And I want to make sure that when you purchase your honey, purchase the raw honey. The regular honey that we're used to seeing, the nice, clear, honey that looks good on the shelf, it's been pasteurized, and that pasteurization process helps to strip the honey of its nutritional benefits. So it's pretty much like you're just intaking sugar. So you want to make sure you get the raw honey to get the best benefits from consuming honey. And lemon is full of vitamin C. It also has tons of other properties, but it's full of vitamin C, and it is a great addition to the tea to help you stay healthy, strengthen your immune system. But in the event that you are fighting infection, it helps to help you recover sooner. Okay, so your honey and your lemon, and we can't forget the ginger. Ginger is a powerful antioxidant. It has a lot of benefits, but I'm going to focus on its ability to strengthen your immune system. And what ginger is known for, even through scientific studies as well, it's known for building your immune system, strengthening your immune system in a way that keeps you less susceptible to getting infection. So you want to drink this as often as possible. A daily cup or two of honey, lemon, and ginger tea will definitely help to strengthen your immune system, keep you well, or in the event that you become positive with COVID or any other flu or respiratory infection, it will help you heal and recover faster. So honey, lemon, ginger tea. And the good thing about honey you can give to your children, and this tea you can give to your children as well. Children 12 months and older, all right? So if you have babies out there and they're younger than 12 months, honey is not recommended for the little young ones, okay? Under 12 months. But for the little ones that are 12 months and older, honey is good as a preventative, but also if your little one is fighting off an infection, flu, a cold, or a cough, honey helps to soothe. So giving them a little honey at night. You can also give them a little bit of the tea, the older ones, making sure that the temperature is right, of course. And you can put the ginger in there. Sometimes ginger can be a little strong, so you can moderate how much ginger that you add. And if not, just give them honey. The honey and the lemon tea will be fine as well. But remember, babies 12 months, under 12 months, they should not have honey. You can discuss this, and you should discuss this with your child's pediatrician or healthcare provider. So another helpful tip is cabbage soup. Cabbage, believe it or not, is full of vitamin C, and it's been known to definitely help with digestion. If you have a stomach bug, if you have any type of tummy troubles or tummy issue, cabbage does wonders for the stomach and also for the respiratory system. So it's easy to make. You can get real fancy with it, or you can stay very basic and simple. The main ingredient that you want to consume is the cabbage in the broth. So what you would do, you would just take a cabbage, shred it up, boil it in water, season it to taste. You can get fancy. You can add other vegetables. You can add onions or whatever it is that your favorite vegetables to make it a tastier soup. You can even put a little bit of beans in there as well. And if for those of you that eat meat and you want to make it a chicken cabbage soup, you can do that as well. But cabbage has a lot of wonderful properties, and it helps you if you have a respiratory illness, a flu or a cold or a stomach bug. It helps you to recover faster, and recover well. So definitely you want to do that. And I would say all of these tips, don't wait until you are sick. Of course, do them if you become ill, become sick, but let this be routine, especially during, the winter months, for those of you that live in cold climates and you're experiencing winter. And just because we're in the thick of things with this pandemic, we want to make sure that we are consuming foods that will help to strengthen our immune system and to keep us well. So the ginger, lemon, and honey tea, the cabbage soup. Another addition that you should incorporate as a routine in your diet is turmeric. Turmeric has a compound called curcumin, and curcumin again strengthens the immune system. Now, all of the ingredients, all of the lemon, the honey, the ginger, the turmeric, it has other benefits as well, but I'm kind of focusing on its benefits on the immune system. So curcumin is antimicrobial, antifungal, antiviral, anti-parasitic as well, and it's been used literally for thousands of years, definitely for centuries, as a medicinal. It's been used in natural medicine. So definitely you want to incorporate your turmeric. And one nice tasty way to do that is your golden latte. So what you can do, you take your favorite plant-based milk, whether it's oat milk, almond milk, coconut milk, whatever it is. I like oat milk. You warm that up. So if you're using 2 cups of plant-based milk, you can use 1 teaspoon of turmeric powder. And again, if it's just 1 cup, then you would cut that in half. You can sweeten it with raw honey, and you can also add cinnamon, and cinnamon has wonderful properties as well that's beneficial to your health. You can crush some ginger in there, but you want to incorporate this at least, you can drink it daily, but at least during this time, I would say, 2 to 3 times a week. So if you're doing your honey, lemon, and ginger, you can do a golden latte with your turmeric, and throw in a bowl of cabbage soup, maybe once a week, twice a week. If you're sick, then definitely you want to kind of have that daily or twice a day, is as much as tolerated in terms of the cabbage soup. Another beneficial property of turmeric, it's known to help fight depression, and depression is one of the side effects of this pandemic, not to mention the winter at times. I live up in the north, and we have much shorter days, and a lot of people go through, they suffer from anxiety and depression just because of the shortened days. And this pandemic has also highlighted or resulted in a lot of individuals suffering with anxiety and depression as a result of the pandemic. And there have been multiple studies, randomized controlled trials, that in one study in particular, a group was given Prozac and a group was given 1 gram of curcumin. Remember, curcumin is the major compound in turmeric, and the results showed that it had similar improvement in terms of mood in both groups. So definitely, if you are taking your antidepressant, I'm not saying to not take that, but if you add in, turmeric, a golden latte routinely, that can help to boost your mood as well. And so we definitely want to take care of our physical health, but we want to take care of our mental health as well. And that's one of the benefits of turmeric. All right, so another important add-on is vitamin D, and I'm sure you've heard that by now. If we haven't heard it before the pandemic, during the pandemic, everybody is talking about vitamin D, vitamin D, vitamin D. One reason why this has come up is that many of the patients who have had severe COVID symptoms were found to be vitamin D deficient or insufficient. And most of us probably are, especially if we have darker skin. So how vitamin D is formed, once you have exposure to sun, it triggers the formation of vitamin D in your skin. And then that vitamin D is further processed in our liver and our kidneys into a more usable form. And that form is vitamin D3. So if you have any type of liver disease or kidney disease, you are probably most likely deficient in vitamin D or the usable vitamin D. So a vitamin D supplement would definitely be beneficial. But I want to say to all of us, we probably all should be on a vitamin D supplement during this time. It helps to boost the immune system as well. And even our little ones. So there is a old-fashioned remedy that my grandmother used to give us as a preventative during the winter, and that is cod liver oil. Cod liver oil used to be given routinely to children, but I'm not exactly sure when the switch or the change came, but now at some point, and I'm not too sharp on my pediatric guidelines right now because I deal with adult patients, but I believe children are prescribed a vitamin D supplement. I don't know if it's at 6 months, but they're prescribed a vitamin D supplement. And formula is the formulas are fortified with vitamin D. And mothers who are breastfeeding, it's been found that their babies don't have enough vitamin D, which is important for growth, for a lot of different things. And so the supplement is needed. And prior to, just in recent times, the switch has been made from cod liver oil to an actual prescription. Vitamin, I'm a little rusty in the area of my pediatric guidelines, but I'm almost positive that a prescription is given. Don't quote me on that. Okay, don't quote me on that. Ask your pediatrician. But in any case, I know that children need vitamin D, and we see now, especially in this wave of the pandemic, that more children are becoming ill. Not only ill, more children are becoming hospitalized, and unfortunately, some are needing, to go in the ICU. So you want to do what you can to help protect the little ones, especially, the younger ones. They aren't even old enough to get the to get the vaccine and booster. But so we have to do everything we can to protect our children as best as possible. Cod liver oil is a great source of vitamin D. There's been studies that studies from a while ago that showed the benefits of cod liver oil in helping patients with tuberculosis recover. So even before the invention of antibiotics, believe it or not, when patients had tuberculosis, they would expose them for a period of time during the day to sunlight. And I'm not even sure if they knew exactly why the patients would show improvement, but they did notice that exposure to sunlight would be beneficial to the patients that had tuberculosis, in addition to giving them cod liver oil. And one of the common, ingredients or compounds in both of those, or factors, if you will, in the sunlight and in the color of oil, is the vitamin D. So it does help to fight respiratory illnesses. So I would suggest that you incorporate cod liver oil back into your daily, and it doesn't even have to be daily, but multiple times a week, and even the little ones, the babies, can get cod liver oil. Again, confirm this with your pediatrician, because maybe your child has specific needs or certain restrictions. So you definitely want to talk about any supplementation with your personal healthcare provider and your child's personal healthcare provider as well. But typically, a half a teaspoon, which is like 2 milliliters or 2.5 milliliters, and a dropper of cod liver oil, and you put it in the formula, and you give it to the baby a couple times a week. Generally, that should be okay and help to boost up their vitamin D. Now, sometimes you could have a reaction in terms of a little tummy upset with cod liver oil. So you want to, when you're introducing any new supplement with yourself or with your child, you want to, try it and then see how it goes. So if you're having any adverse reaction to anything, the first thing you want to do is just continue it and make sure that and to see what's going on. So again, with that being said, if you're trying multiple new supplements or new supplements, it's best to separate them and try them, add them one at a time, just in case you do have a reaction to something new that you're trying. Okay? Again, discuss with your personal healthcare provider as it relates to trying new supplements, or doing new supplements or new interventions for your children as well. There are some things that interact with prescription medications, so you want to be careful with that as well. Okay, but vitamin D is needed, and we have to do. We can't forget about the little ones, and fortifying their immune system as well. Probiotics help to strengthen immunity. So we all should be on a probiotic during this time, in my opinion. Again, you can confirm it with your provider. And there are even probiotics for the little ones as well. Okay, so look into that. Now, there are some other things that I want to share with you in the event that you become sick with COVID, because it is spreading like wildfire, whether you are vaccinated or not. And yes, I do believe that vaccines and the booster are an important layer of defense. It's an important layer of defense, but it's not the only thing that we should be doing. In addition to getting the vaccine, if you are eligible, you should also, very important, you should wear your mask. You should wear your mask, and during this time, you should seek to wear an N95 or a KN95. It protects, if it's good quality, it protects against 95% of particles in the air. Thus the 95. That's where that number comes from. And you want to make sure you wear the best quality mask as possible, because this particular variant of the SARS-CoV-2 virus is highly contagious. I'm sure you know someone that's sick, or you yourself may be recovering or going through it now. So you want to make sure that you have on your mask when you go out, when you're in, crowded spaces, open spaces. You want to wear your mask, and you want to make sure it covers your nose. It is not going to work if your nostrils are hanging out. So make sure you cover your nose, cover your mouth. And if you are going to be in super crowded spaces where it is impossible to social distance, I would suggest having some safety eyewear as well. This is what we do on the floor at the hospital when we're taking care of COVID patients. And I want you to assume that everyone you see out in these streets has COVID. So do your best to protect yourself in terms of wearing your mask, safety glasses when necessary. If you're going on a plane ride, I would suggest that you cover those eyes as well. Definitely, you want to have your hand sanitizers and you want to have your wipes available with at least 70% alcohol. And of course, disinfecting in your home, highly touched surfaces as routine, kind of disinfecting and keeping things as clean as possible. Another suggestion is that you get a air purifier in your home. So with a HEPA filter, they have different sizes. So based on the space or the size of your room, you can determine which HEPA filter you should get. And you want to make sure you keep up with changing the filter as indicated, and that will vary from air filter from purifier to purifier. But definitely I recommend you getting a purifier in your home. And if you live in climates that are not experiencing the frigid cold that we are up here in the north are experiencing, from time to time open up those windows and let some fresh air come in. Let the air circulate that air, get that fresh air in there. Okay, now there is this device that I think all of us should have. It's called the Pos Oximeter. And in the event that you have COVID or the flu or any other respiratory illness, you want to have this on hand so that you can monitor your oxygen saturation. So what this device does, it helps to give you an idea of how saturated your hemoglobin is. So hemoglobin is a protein that is in your blood cells that carry oxygen to all the tissues in your body. So every tissue in your body needs oxygen to function well. And so this will give you an indication of how well you are oxygenated. If you don't have any chronic lung diseases such as COPD or other chronic lung diseases, then the normal range for you should be 95 to 100. Okay, so sometimes COPD patients run lower in the low 90s or even high 80s, but you should know your baseline. So if you're let's say you have COVID and it's you're coughing and you feel a little winded, you feel short of breath, and you check this and it is on the lower end of the 90s, then you want to go in and get checked. You don't want to wait. You want to go in and get checked just to see if there's something that can be done to help. And ideally, we want to help. We want you to not have to be hospitalized and for oxygen or worst case put on a ventilator. So these little devices come in handy. So please, you can go on Amazon, or I think Amazon might be the best place right now to get it. So some tips for getting a good accurate read. If your fingertips are cold, you can just kind of rub them in together to warm them up. Sometimes if your fingertips are cold, it does not give, it has trouble picking up the read. Another thing as well is that if you have nail polish on, especially the gel nail polish, this may interfere with accurate readings as well. So you might want to remove that gel polish if you are currently sick and you want to monitor your oxygen saturation. Another thing that this device will tell you is it will tell you your heart rate. So some COVID patients are discovering that they're having difficulty, heart-related difficulties. So maybe you're experiencing palpitations. That's one of the things that we're seeing. This can tell you if your heart rate is elevated. So a normal heart rate is between 60 to 100 heartbeats. And if you're, you're at rest. Now, of course, if you're walking upstairs or you just finished exercising, then your heart rate is going to be elevated and most likely it'll be over 100. But there's a reason for that. But if you are just at rest and you are, you check your oxygen and you notice that your heart rate is elevated, just keep an eye on that as well. For people who are recovering from COVID and you're noticing palpitations and you're noticing, maybe you feel a little winded, or even at rest, your heart rate is elevated. And so when I say noticing palpitations, it feels like your heart is racing. Sometimes COVID patients, even after recovery, still have those symptoms, and I would advise you to talk with your primary care provider, and it would probably be a good idea to be seen by a cardiologist just to make sure everything is okay in terms of your heart. And so with some of the tips that I gave earlier, like the ginger, the turmeric, the lemon, they all are good for cardiovascular health. And so that will help to strengthen your heart as well. For some reason, COVID seems to be affecting the heart in many patients and many individuals who test positive for COVID. So I want you to keep an eye on that, your heart rate, how you're feeling. And I don't want you just to sit home and say, okay, this is normal, it'll go away. Sometimes when we have that mindset that, it's going to get better, it's going to go away, and then you don't go in and get checked, then, what could possibly be prevented if you're seen earlier can now be made worse if you wait. And so I don't want you to panic. I don't want you to, be anxious about it, but I just want you to be aware that there are some things that can be done. And, seeing your doctor, seeing your cardiologist, or getting, just even if you've never seen a cardiologist before, but if you had COVID and you're having heart symptoms, then your primary care can refer you for a one-time visit just to make sure everything is okay in that area and there's no other treatment or interventions that's needed. All right. So while I'm on this topic, if you've had COVID or if you are in the middle of your quarantine for COVID and you have cough, even if you took a chest x-ray before and it was negative for pneumonia, if you still have persistent cough and it doesn't seem to be improving even after your quarantine period, and you're, sometimes you feel winded, sometimes you feel some chest tightness or shortness of breath or whatever it is, you want to have a chest x-ray done because pneumonia can settle in later, okay? And if it shows pneumonia on the chest x-ray, sometimes you can be given, an antibiotic to help improve it. If it's viral pneumonia, at least it's something that you can keep an eye on and your healthcare provider can keep an eye on. So again, if you're having lingering cough and it doesn't seem to be improving, even after you are over your quarantine period, or even after you had a chest x-ray and it showed negative for pneumonia, it doesn't hurt to get, checked out again. Okay. So always stay in contact with your healthcare provider. And if you don't have a healthcare provider, then go to urgent care or go to the ER, and just let them know you're having this cough. It's not improving. It's not getting better. And you're concerned and you want a chest x-ray. Okay. So those are some things that I want you to keep in mind. Another thing, and I think this will be the last thing for now that I want to share with you, is that if you are diagnosed with COVID and you are in a high-risk category, there are some possible treatments that you can get. And one of the treatments are monoclonal antibodies. You probably heard of this particular treatment. I know at the beginning of the pandemic, it was not given to everyone because they didn't have a lot of the supply. And it's not that they have massive supplies now, but it is much more readily available in the community. And they recommended, the FDA has approved the administering it to high risk patients. So now your next question could be, am I high risk? So I want to read the list of what is considered high risk. So high risk categories include being 65 years of age or older. If you are overweight, so what that means, you have a BMI of over 25. So if you are pregnant, you are also considered high risk. If you have chronic kidney disease, you are considered high risk. If you have diabetes, both type 1 and type 2, that's high risk. If you have a weakened immune system, or if you're taking medications that suppress your immune system, you are considered high risk. If you have hypertension, or if you have cardiovascular disease, you are also considered high risk. Chronic lung disease, high risk. Sickle cell anemia, high risk. And any neurodevelopment disease, you are considered high risk. Now, the thing about monoclonal antibodies, and I'm going to share my screen in a moment because I want to kind of give you an idea of how to look for sites in your community that offer this treatment. It's good to know in advance what's out there, and then also maybe there's some other individuals that they may not have access to the internet, and they probably can't hear my YouTube channel, but you can share the information with them to let them know what's available for them. So what monoclonal antibodies are, they are the antibodies that are manufactured in the lab. So the the SARS-CoV-2, I don't even know if I'm saying that right. Well, the COVID virus is a novel virus. And what that means is that our immune system was not accustomed to this virus. And so it was new to our immune system, and it was replicating very fast, as viruses do, and causing a lot of harm. Typically, when our immune system is exposed to a pathogen, it takes about 10 days to start to develop antibodies. And with this virus, we were having a high rate of death and making the antibody in the lab. So what the antibody is, it's a protein that neutralizes an antigen. And in this case, the antigen is the spike protein on the outer layer of the COVID virus. So this antibody was manufactured in a lab, very powerful, and if given to the individual, especially high-risk individuals that are at risk for severe disease, severe COVID, hospitalization, possibly death, it was found to help lessen the symptoms and reduce the need for ventilation, for the ventilator as well. So the key thing for getting the monoclonal antibody treatment is that you get it sooner than later. Okay, you get it sooner than later. So if you're having mild to moderate symptoms and you are in the high risk category, you should, contact your primary care provider or contact some of the sites in your community to see about getting the treatment. So what it is it's administered through IV. So you would go to one of the treatment sites, and it's about 20 to 30 minutes in terms of the length of the IV, and then they'll monitor you for about an hour to see how well you did to the treatment, if you have a response or need further intervention, and then they send you home. So this is done on an outpatient basis, and many people who get the monoclonal antibodies in these high-risk categories, they do not progress. Their COVID does not progress to severe COVID requiring hospitalization. So I'm going to show you how you can look it up in your community. Now I'm going to do my home state in terms of showing you. Let's see here. Okay, 1 second. Let me just pull it up and then I'll share my screen. Oops, okay. All right, so let me just go to Google. Okay. All right, so let's see here. All right, so now, so you would just go to Google. So depending on, whatever state that you're in, I would type where to find. So I'm going to use South Carolina as an example. Monoclonal antibodies in South Carolina. So again, if you live in Colorado or if you live in Arkansas, you can just put your state. So what comes up here is the South Carolina Department of Health and Environmental Control. And so this site, for those of you who live in South Carolina, has a lot of useful information. You can scroll down and, yeah, so it's SARS-CoV-2 virus. Okay, that's what I think of. I was trying to say that. Not sure if it happened. So I'm going to just open my screen. There we go. And so on the right side, there's a very helpful flyer here. And it's something that, whoops, what did I do? Technology, Okay, so I guess I do have to make my screen larger. Okay. So there's this flyer that you can actually print out if there's individuals in your community that they're not, they don't have access to the internet or they're not typically on it. This flyer has a lot of information here. All right, I'm going to try again to minimize it. Let me see. No, every time I minimize it, it goes to this gray screen. Interesting. Okay, so let me go back and let me try it again. Oh, wow. This is too big. All right, guys, I'm really going to get this together. This is my first time using this program because I wanted to. Okay. Oh, I see. So it's the zoom. I think I have it zoomed out like a million times. Oh boy, come on. Okay, so I think I got it now. So this flyer is very helpful for those of you that are in South Carolina, and I'm sure all of the other states may have something very similar, and the information will definitely be similar. So it has a little description here of what monoclonal antibodies are. Monoclonal antibodies are laboratory-made molecules that act as a substitute antibody. They can help your immune system recognize and respond more effectively to the COVID-19 virus, making it more difficult for the virus to reproduce and cause harm. More viral load, more harm. Okay, so you want to definitely, if you are in the high risk category and this is something that you want to look into, you want to do it as soon as possible if you are COVID positive. So some of the qualifications to get the monoclonal antibodies are, of course, you have to have a positive COVID-19 19 tests and had symptoms for less than 10 days. Another criteria, you have to be in one of the high risk categories of getting more serious symptoms. And you cannot be already hospitalized or requiring supplemental oxygen. So definitely, if you are in the high risk category and you're saying, oh, my symptoms aren't so bad, this is the time to get the monoclonal antibodies so that you can keep it that way. All right, so a few other tips here. So children aged 12 and older who weigh at least 88 pounds and are high risk can also get the monoclonal antibodies. So I'm going to show you how to find some sites. Just going to click out of this. Okay, so if you go back to the home page, oops, here we go. If you go back to the home page and you keep scrolling down, you will eventually, again, this is just an example. I'm using South Carolina as an example. You will see a map here of the state of South Carolina. You can zoom in or out. And if you hover over these blue dots and you click, it gives you the name of a center that offers the monoclonal antibodies. So if you're in the Myrtle Beach area, you can receive this treatment at Doctor's Care, Market Common. So if you don't have a private, a PCP, healthcare provider, then I would just contact the center just to see what their policy is of, how can you obtain this treatment if you feel that you need it. So if you're in the Beaufort area, there's a few sites there on Ladies Island, the Low Country Urgent Care. There's some in Jasper County, and if you're up at the top in the Greenville, Spartanburg area where my peeps are, there are a couple of sites there, multiple sites there as well. So I wanted you to be in the know. Again, this is just an example for South Carolina, but I'm sure that in your state you can do the Google search and also see where they are offering the monoclonal antibodies near you. I hope that this video was helpful. Please, if you found any value in the video, please like, subscribe, and share this information. And as always, until next time, please stay well. Thank you so much for tuning in, and I'll see you soon. Thank you.